climate crisis. So this session will really tease out what some of the youth-led solutions are to this generational challenge.
Of course.
The other session is that you could join is We Lead, youth-led advocacy strategies for sexual and reproductive health and rights and bodily autonomy, because I think we can all agree adolescent and young people should have control of their bodies, their lives, and their choices. And I'll be joining that session.
Of course. But first, we're going to hear from environmental activist Dominique Palmer, who has an important message on climate justice for us. See you all again after that.
My name is Dominique, climate justice activist from the UK. Hello to everyone at this Global Forum for Adolescents. It's so great to be speaking with all of you, and congratulations to everyone who took part in the amazing global survey of over 1 million young people saying what young people want for the future. As young people, our voices deserve to be heard, and so many of you are already using your voice to stand up for the future you want to see. In the survey, a cleaner, greener world was right up there with what you want for the future. We can all agree on that, and it is something we truly can achieve when we rise up. But my message to you today is about climate justice, because justice has to be at the heart of everything we do. We need to be sure people are not left behind. We need to look at the equitable side of climate action. There is a lot of focus on polar bears and trees, which is great, of course, and very needed. However, we must also look at intersectionality. The climate crisis is not just something far removed from us, it's also about us, about people and societal structures. Climate justice doesn't exist in a vacuum, separate from society. Social and economic inequalities are at the heart of it, just as they are at the heart of all you are talking about these 2 days of the Global Forum. Everyone deserves the right to a safe and clean environment, water, air and green spaces, but not everyone has access to these or the resources to mitigate the effects of climate change. So part of climate justice is something called a just transition. This is all about protecting vulnerable and marginalized communities. Due to social and economic inequalities, some communities are more at risk to the climate crisis. This is an unequal crisis. We have to bring everyone along with us, so we must look out for those who are being disproportionately impacted. We must look at racial justice, gender justice, disability justice, and more, so that everyone has the right to a safe and clean environment. The exploitation of people and our natural resources is fueling the climate crisis. And so to create a greener future, we must demand climate action that addresses these inequalities. Not everyone has the access to resources to mitigate the damage of climate change, such as extreme weather impacts, food and water scarcity, air pollution, health impacts, loss of nature spaces, and the impact on people's well-being. We have power in demanding action that creates a better future for all of us. We need to decarbonize in a way that doesn't leave anyone behind. We have to look at reparations and loss and damage. Countries on the front lines of climate change contribute the least to the climate crisis and yet are facing the worst impacts. So reparations means that the richest countries who have contributed the most to climate breakdown pay to help countries mitigate climate change. Richer countries need to stop exploiting our natural resources and people and support a just transition everywhere. We need to live in harmony with nature and wildlife, and not continuously take from it without giving back. I have a vision of a better world in which all of the intersectionalities I mentioned are truly included in climate action, and one where, instead of the separation from nature that we live with now, let's look at how beautiful our world is and how much we still have to protect and save. This earth is precious and the only one we call home. A green, just and safe future is possible. We can demand it. We can reclaim the future that we deserve. The oceans are rising, but so are we. Another world is possible with justice at the heart of it. Thank you.
when I started to volunteer for OAY, I was really new to the field of CSOs and NGOs and humanitarian work. Through the series of trainings, I think I've really grown in the advocacy world. I feel like my voice is being heard, especially when Kenya was transitioning. There was elections, so there was leadership transitions. Just being able to approach leaders and talk about their manifestos, just requesting them to add adolescent well-being into their manifestos, that really felt good. That felt powerful. I feel like the government is listening, especially now more than ever. They realize that the population of young people in Kenya is very high. People below 35 years is 75% of the population. So I think more than ever, they are focusing and listening to the young people and the adolescents, and it's a good move.
We're facing a learning crisis around the world. There was already too much inequality in education, and the pandemic has made things worse. Today, in low and middle income countries, up to 70% of 10-year-olds cannot read and understand a simple sentence. Without basic reading and math skills, it will be harder for kids like me to contribute to our future, our families, and our communities. When there is less access to digital tools, there are fewer ways to boost learning. That's why UNICEF developed the Learning Passport. Since the Learning Passport launch in 2020, the program has reached millions of users in more than 20 countries. It's being used to support children, young people, teachers, and parents in all sorts of ways, including formal primary and secondary curricula, skills development for adolescents, teacher training, early childhood education tools, and key resources to support girls. Your help mobilizes experts, increases the reach of products and services, and encourages involvement from the private sector. So join us. Help revolutionize the educational landscape for kids like me.
We are 1.8 billion young people in the world today, standing as one to reach.
Hello, good afternoon, good morning, good evening. I don't know where you're listening from and joining this discussion, but I am so excited to have you here. Hope you can see that on my face. Welcome to the Global Forum for Adolescents. And allow me to highlight that actually this day is coincidentally meeting with the International Day of the Girl Child. So happy International Day of the Girl Child to everybody here. And back to our segment, we are discussing what we are saying. We lead youth-led advocacy strategies for sexual reproductive health and rights and bodily autonomy. I'm going to be your moderator, and my name is Musonda Memorich Kombo. Allow me to give you a brief background about myself. So basically, I am a student of development studies, and I'm also currently employed with Alliance for Accountability Advocates Zambia, where I'm leading on the SHISOS project. And SHISOS simply means sexual and reproductive health and economic empowerment, supporting out of school, adolescent girls' rights and skills. That is a project with Youth Coalition. And I also had a certificate in drug addiction counseling and a licensed counselor in psychosocial counseling and HIV testing. You should be looking forward to the people that we have today as our speakers, which I'll be doing shortly. So in this particular segment, we have amazing young people that are doing amazing works who are going to be our speakers for today. And basically in this space, the discussion is meant to highlight youth efforts to advocate for sexual reproductive health and rights from the diversity of organizations that convene this panel. So from the young people that we have here, we have representatives from Fòs Feminista, Youth Coalition, the World Health Organization, International Pharmaceutical Students Federation, that is IPSF, and Guttmacher, not forgetting Save the Children. So now allow me to take you to the speakers that we have. They'll introduce the full names and also give us their pronouns when they'll be coming to speak. But the first one is Romina. who is currently an assistant in Promsex strategic litigation area. She has contributed as a consultant on trans population human rights for civil society organizations and UNFPA. With a background in youth activism, she served in various capacities such as co-mayor, advisory board, as a council member and UN volunteer for the SDGs. So looking forward to hear from Romina. And then we have Salma, who's a representative of Children and Youth Advisory Network, which is called CYAN, Save the Children Indonesia, as she is active in her activities as a child campaigner in the West Java area. Also, she's a college student in social work. She's currently involved as a youth researcher for youth-led research on sexual reproductive health and rights and mental health with Save the Children Indonesia to do evidence-based advocacy on adolescent health issues. Then we'll go on to Sarah, who is a pharmacist by training. She received her PharmD in 2020 and is currently working as a pharmacy resident in Algiers, Algeria. Sarah has taken an active role in the International Pharmaceutical Students Federation since 2019, where she served as the coordinator of public health activities and public health policies. She's now IPS chairperson of public health for the 2023 to 2024 mandate, representing the voices of over 500,000 pharmacy students and recent graduates in global health meetings. You better be looking to this conversation that we're going to be having. And then we have Felmika, who is an undergraduate student of integrated BALLB program at Maharashtra National Law University in India. She is passionate about adolescent health and well-being, including SRHR and human rights, and she has been active in the youth advocacy since 2018 and is a national representative of YPER, that is YPER India Youth Network, a youth-led, youth-run pan-Indian network supported by YPER Asia Pacific Center, Thailand. And lastly, not the least, we have Semaria, who is a social worker student and is passionate about advocating for meaningful and inclusive youth participation, sexual and reproductive health rights, and inclusive education. As a Yali alumni, she excelled in the Yali RLC public management track, winning for the innovative project on integrating children with neurodevelopmental disabilities into public schools in Ethiopia. In her daily work, Semaria collaborates with health and youth centers, guiding young people in making informed decisions about sexual reproductive health and rights. I'm just wowed. So these are young people that we're going to be discussing with in today. Hopefully you can still be with us. Before we can dive into that particular discussion, we have a poll that we have to make and carry out. So we're going to be having a poll before we go to our discussion, where the audience will have to answer 2 particular questions regarding access to sexual and reproductive rights. So are we ready to take on that one? Okay, so the first question that we're going to be responding to, that is going to be posted, is abortion criminalized in your country? Just say yes or no. Is abortion criminalized in your country? Yes or no? That is the first question. And then we have the second question, that is, did you receive comprehensive sexuality education, CSE, when you were young? Yes or no? Did you receive comprehensive sexuality education when you were young? So let's have that moment to just comment on those 2 questions in the poll, and then we'll continue with the discussion. So the first question, which is supposed to be yes or no, is asking the audience and people here to say, is abortion criminalized in your country? Yes or no? And the second question is, did you receive comprehensive sexuality education when you were younger? Okay, I guess the poll is still coming through. We're still receiving your polls. Please keep your comments coming. Just comment on what your response is, just yes or no, and we should be able to get that feedback. All right. So allow me while the pause is going through and while I'm waiting to see the feedback from the majority, we'll be moving to the first segment where I get to ask the panelists that we have, the speakers here on the platform, questions that they'll be taking on. Okay. So the first question, which I would respond to, because being a moderator, I have an experience, I have my own success stories, which I will highlight. And on this particular one, the question is being asked to say, what strategies are you using to face the main SRHR issues your organization acts on? So in your own organization, where you're coming from, what are the main strategies that you're using to face the sexual reproductive health issues that your organization is looking into? And I would like to speak about the organization that I'm coming from. Basically, it's called Alliance for Accountability Advocates Zambia. That is AAAZ. And we have a project that is being led by us through the Youth Coalition called SHISOS that I highlighted in my preamble. And we have many advocacy issues that we're looking into in regards to sexual reproductive health and rights. And I'll just highlight three that we mapped and prioritized. So we noticed that the first one is in regarding to the stock out of sexual reproductive health and services. We've noticed there are a lot of stock outs in this different clinics that we go to, the spaces where adolescents are expected to access the service. Also, we noted that there is no priority put towards the budgeting. We do not have a specific budget that speaks to adolescent sexual reproductive health services. So we felt there was a gap and needs to be addressed. And the last one comes to representation. You know, in as much as we're trying to talk about these issues, we need to make sure that in this decision-making procedures, we have representation. So that is how we are trying to handle that as a main strategy. And how we're doing it basically is recognizing the fact that we cannot work in silos. As organizations, we need to work with other stakeholders, government, the implementers. So our strategy has been involving the implementers, the decision makers, and to be specific, Ministry of Health, because we know they're in the forefront. So we're trying to have them on board to work with us to make them realize that they have the biggest role in actualizing these issues that we are facing. And so far, by making them own the challenges and see that they have the biggest role in actualizing them, they have started taking up on themselves to say in their individual capacity or in their position as maybe a director of health, what are they going to do different to see that these issues are being addressed? So that is one of the strategy that we're using, and it was basically through a mechanism that they call accountability mechanism that we used as a project under SHISOS. Okay, so let's get down to hearing from other speakers, and the first one is going to be Sarah, who's going to be responding to the question that is, what strategies are you using to face the main sexual reproductive health and rights issues your organization acts on? Let's have Sarah on the floor. Okay, is Sarah ready to speak? Sarah is going to be responding to the question, what strategies are you using to face the main sexual reproductive health and rights issues your organization acts on? So basically, we just want to understand. Okay, I think Sarah is trying to speak.
Sorry. Can I confirm that you can hear me clearly?
We can hear you.
Okay, perfect. I had to turn on my camera because of the small technical apologies for that. But thank you very much for the floor. Thank you for the invitation as well. So I come from IPSF, which you've briefly introduced at the beginning. And at IPSF, we do recognize our role as future and young pharmacists in advancing SRHR, as well as the shared responsibility that we have to raise awareness, particularly among adolescents, and to respond to their needs. And we do try to achieve that through two main strategies. The first one is through designing projects, sessions, and campaigns, where we talk about things like FGM, bodily autonomy, period poverty, STIs, and HIV, and more of this, and which like could really serve as a platform for the empowerment of our members, like pharmacy students, and enables them to initiate their own advocacy on local level. And the second is when we do take their asks all the way to high-level meetings, UN high-level meetings, such as the World Health Assembly and the recent statements that we had on children's health in last May, where we really touched on the issues of like the role of pharmacists in reducing adolescent pregnancies, etc. But yeah, thank you very much.
Okay, Sarah, thank you so much. Can we get just maybe a success story from some of this? Like you highlighted that you get to define the projects like campaigns. Can you highlight something that came out as a result of the campaign? Just under maybe 30 seconds, just highlight one of the success that we had through this campaigns that you've had.
Yeah, so I think what I mainly want to highlight is that our campaigns usually like impact, like allows our members or are created to be like as a resource for our members to act locally. So if we count the number of campaigns that we usually have, like on local level, it's like over around like 100 of campaigns every year. And if we do go statistically and like look into how many people we've had the chance to speak to, then that would be just like multiply of those numbers. So I think this is one of the achievements that I want to highlight, is the fact that we take our advocacy into a local level. Thank you.
Amazing. Thank you so much for that. And it's becoming my highlight, taking the advocacy to the local level, communities, decentralization. Great. Okay, so the same question is going to go back to Salma to just highlight for us the main issues that they're targeting and the advocacy strategy that they're using, or rather the strategy. So let's have Salma responding to the same question.
Okay, thank you for the opportunity. I'm Salma, part of Children and Youth Advisory Network, or Science of the Children in Indonesia. Together with the National Children Forum, we conducted evidence-based advocacy to the government of Indonesia. We just started with youth-led research about adolescents' perception on reproductive health, develop policy brief, dissemination of the research, and will continue ministerial roadshow. It also linked to global advocacy efforts. The background of this youth-led research is our concern as adolescents who might be exposed to reproductive health issues such as sexual transmission, HIV, sexual violence, and teenage pregnancy. The research, using online survey to 433 adolescents from 31 provinces and in-depth interview with 10 adolescents from 7 provinces, including the adolescents with disability in Indonesia, aims to describe and analyze 1. Adolescents' comprehension on reproductive health, 2. Communication channels used by adolescents in getting information on reproductive health, and 3. Adolescents' participation in utilizing reproductive health services provided by the government. The key findings are 1. Adolescents have not yet possessed a comprehensive knowledge about reproductive health, which they only know about puberty and human reproductive system related information. There are some who even hesitant and reluctant to explain about it. This is not in line with what UNESCO recommendation. There should be at least 8 topics. 2. Reproductive health problems are defined by individual factor, the relationship with the family and peers, as well as educational institution and community. 3. The reproductive health information source obtained from digital media are still far from being inclusive to embrace all types of disability and not yet supported with adolescent-friendly services from health facilities. And 4, adolescents are aware, able to access nor being involved in government's adolescent health program in Indonesia. So our advocacies ask, such as 1, increased capacity, and integrated services provision that involves adolescent, peer, family, educational institution, and community on comprehensive reproductive health. 2, develop regulation of reproductive health information, which also includes adolescents from various backgrounds. And 3, development of adolescent health service that is inclusive, participatory, responsive, and fulfilling the adolescents' needs. I think that's all about our strategies.
Amazing. Thank you so much for that complex explanation. Really, you're doing great work. The highlight of that is the issue of youth-led research. Okay, let's hear from Samaria and what the strategies have been. The question is, what strategies are you using to face the main sexual reproductive health issues your organization acts on? Samaria, please take the floor.
Hi, everyone. This is Samaria from TAIA, formerly known as Talent Use Association. So in my country, Ethiopia, the SRHR topics are usually considered taboo, and they're not usually most people are not outspoken about it. So as TAIA, we work towards creating awareness about SRH, correcting misconceptions, and creating youth-friendly SRHR services to be given in health centers and hospitals young people find nearby. So in order to do that, some of the strategies we use is capacity building, digital advocacy, preparing different fact sheets, and providing the right information for adolescents and youth. So in order to do that, one of the powerful tactics we use is evidence-based advocacy to advance the adolescent and youth health, sexual and reproductive health. Like, as most of you know, numbers say a lot, and help with our advocacy and allow policy and program designs to be better informed and equitable. So I think what we've been doing as TAIA is the adding it up research by Guttmacher Institute has helped us in our evidence-based advocacy efforts in advocating for policy level, for young people to get the right services. And Guttmacher Institute's data provides the cost and impacts of investing in adolescent sexual and reproductive health in lower and middle income countries. So one success story is one of the many is that the adolescent and youth health strategy, we advocated through the Guttmacher's data, we advocated for adolescent and youth health strategy to be implemented. So now youth-friendly SRHR services are easily accessible and are mandatory in the strategy. So what we're left with is advocating for the strategy to be implemented properly. So in order to do all this, our evidence-based advocacy and the data we got from Guttmacher Institute, adding it up research by 2018, has been an eye-opener and has brought a way for us to advocate at a bigger level. Thank you.
Okay. Thank you so much, Samaria. I love the explanation, and I'm getting highlights of the main points that have been brought out by the speakers. And Samaria's was invest in adolescents' sexual reproductive health and rights. Bravo. And then we're going to have another speaker coming through, that is Romina, to give us her strategies that they're using in their organization and just the success story that they have regards to sexual reproductive health and rights. Romina, over to you.
Gracias por la pregunta. Buenos días con todos y todas, aquellos que nos están viendo atrás de la pantalla. Bueno, Promsex es una organización feminista que trabaja principalmente en Perú, país ubicado en la región latinoamericana. Según data y estadísticas referidas al acceso a la salud sexual y reproductiva de adolescentes y jóvenes en Latinoamérica, y es constantemente puesta en discusión por los sectores conservadores de la sociedad. América Latina es una de las regiones más desiguales del mundo. Es así que Promsex trabaja como una de sus principales líneas temáticas la defensa de los derechos sexuales y reproductivos y el acceso a la salud sexual y reproductiva. En todas estas áreas temáticas tenemos en primer lugar el fortalecimiento de capacidades, en donde mediante la educación podemos prevenir el embarazo adolescente de aquellos embarazos no deseados que interrumpen el desarrollo de las y los jóvenes y adolescentes y los llevan a una cadena de pobreza y subdesarrollo. Además de ello, realizamos tareas de investigación en derechos sexuales y reproductivos, realizamos lo que es la incidencia a nivel internacional en órganos de Naciones Unidas, como en el órgano regional de Latinoamérica, que es la Organización de Estados Americanos. Asimismo, realizamos incidencia local y una de las principales actividades que tenemos es el litigio estratégico de casos que vulneran propiamente los derechos sexuales y reproductivos en la región. Algunas historias de éxito en la defensa de los derechos sexuales y reproductivos por parte de Promsex tenemos desde el fortalecimiento de capacidades, que el proyecto Derechos desde el Inicio ha fortalecido a jóvenes y adolescentes en Perú en la defensa de sus derechos sexuales y reproductivos. Asimismo, Promsex, en colaboración con UNFPA, hemos realizado una guía de estrategia de educación sexual integral fuera de la escuela. Desde el área de litigio estratégico, Promsex ha litigado ante el sistema de Naciones Unidas, específicamente ante el Comité de Derechos del Niño de Naciones Unidas, el caso Camila, el cual habla acerca del acceso al aborto terapéutico de una niña que fue víctima de violación sexual por parte de su padre, y este caso ha sido ganado ante este Comité de Naciones Unidas y actualmente tenemos recomendaciones que son de obligatorio cumplimiento para todo el mundo, no solo para Latinoamérica, sino que es un gran instrumento que nos permite precisamente hacer la defensa de los derechos sexuales y reproductivos. Eso sería todo respecto a la primera pregunta. Muchísimas gracias por el espacio y espero sigan interactuando y participando.
So that was Romina. I guess I could tell that some people saying the translation didn't actually play. So we might have to get from Romina later with the translation. Yeah, for now, let's get to Bamika. Apologies for that, Romina. But we'll just make sure you just go through maybe in less than a minute later after Bamika gets to speak to the same question. Bamika, please, over to you.
Thank you, ma'am. Thank you so much for having me and for this wonderful question. Warm greetings, everyone. I'm Bhumika Gupta and my pronouns are she, her. So I'd like to start with giving you context of what my organization is. So I'm the national representative of YPR India, which is YPEER, which stands for Youth Peer Education Academy. It is a youth-led and youth-driven network which was initially established in the year 2010, but then eventually became inactive due to certain reasons, including the COVID-19 pandemic. We are currently in the process of revitalizing our efforts and re-establishing and sort of restructuring it. We are committed to develop peer leadership while meaningfully engaging young people between the age group of 10 to 35 years, coming or sort of residing in India, and we're also fostering collaborations with other national networks in the Asia Pacific region. We are actually intending towards addressing sort of critical SRHR issues of regional national concern, including HIV and AIDS prevention, gender-based violence, peer education, mental health awareness, etc. Recently, in YPR India in collaboration with YPR Asia Pacific Center, which is based at Bangkok, we conducted a national e-course on the title Sexual Reproductive Health and Rights and Peer Education for people between the age group of 10 to 35 residing in India. From September 15 to 17 to 2023, we had applicants for we had around 70 applicants, out of which 26 people finally graduated from the course, which means they completed the course with with equal to or more than 80% of the attendance. So the primary aim behind conducting this course was to induct new members and train them to become peer leaders or peer educators, and also to sensitize them and create awareness around topics or issues relating to SRHR. And then the relevant Indian laws about regarding it. In addition to that, we're also conducting various other outreach or capacity building activities. Just to refer to the strategies that we are sort of looking forward to, I'd also like to mention that recently I interned in a national NGO named Udyan Care Home, which is based at Kurukshetra, Haryana, India, which is dedicated towards children in need of care and protection. There we had girls between the age group of 7 to 17, and there were so many of them who didn't know actually how to read or write. So I used audiovisual sort of aids and customized towards their needs. And, sort of, I sort of conducted sessions in the regional language, like, which is, Hindi. And also used, sort of dramatization, which is actually referred to as Nukkad Natak, to sort of create awareness among them and sensitize them about topics like child sexual abuse, or, menstruation, menstrual products which are available in the market, menstrual hygiene, or child labor, child marriage, and related areas. If I specifically refer to the success story, then I'd come back to the national ecos that we conducted. So I think the pertinent thing that I'd like to highlight here is that, we had people, like 26 people who graduated the course, from which we had people coming from 12 different states out of the, 28 states and 8 union territories that we have in India. All of them were between the age group of 10 to 35 years and coming from diverse backgrounds. So like, there were students who were engineering students, legal students, medical students, public health students. And so they were coming from very diverse areas who, sort of associated with one NGO or the other, and, who were sort of interested in this field. And other fact was we had around 9 resource persons covering 9 different topics in the ecos. And the youngest of them was a 13-year-old that we had on board, who was a champion trainer in UNICEF's Youth Advocacy Guide, which is kind of something that I wanted to highlight as a success story. Thank you.
Thank you so much, Bhumika. And I love the fact that you also highlighted what you're doing as an organization, just so we see how similar and how, if we're to be united and work together, we'll make sure all these issues that we're talking about are really resolved. So being that you're the last person that spoke, I'd like for you to be the first on this particular question that we have, which I'd like you to maybe go to 1 minute at least, if you're to highlight the pushbacks or the difficulties that limits you in your advocacy, what would they be? Maybe if you can give out 2 main pushbacks or difficulties that you face in the advocacy space, starting with Bhumika.
Thank you so much. To refer to 2 main difficulties that we personally faced was, advocating for sexually productive health and rights in India presents a unique set of challenges because India is very rich in terms of, the diversities that we have, in terms of the culture, the regional languages that people come from, and, sort of the language barriers that we have to address when we are sort of addressing SRHR related topics. So for that purpose, we have to specifically, sort of design tailored programs, workshops, initiatives for different age groups, sort of making them in different regional languages so that we can reach out to as many young people as we can. And the other aspect of it is, earlier as I mentioned, we also have to sort of use different techniques, either animation or dramatization to sort of, reach out to as many young people as we can. The other issue which actually comes forward is related to certain, India as a society is like, we're not very, some regions in India, they're not very open to discuss about topics like SRHR. So we need to sort of, we need to sort of talk about it in a very, we need to take care of a lot of things when you're talking about it, specifically reaching out to younger adolescents between the age group of 10 to 14. So those are the 2 main difficulties that we face while we're advocating for SRHR. Thank you.
Thank you so much, Bhumika, for that. So I'm getting translation where you needed to translate to different languages and segregating the ages. Okay, I'd like to hear from Romina now on the challenges. Just, you can highlight 2 main pushbacks that you get to face in your advocacy space.
Gracias por la pregunta.
Thank you for the question. In my work as a human rights advocate, especially sexual and reproductive rights, we face several obstacles, considering that Latin America is a region with a lot of taboos around sexual and reproductive rights. Being that one of the main obstacles to implement, for instance, sexual education in public schools. Another obstacle that we face are age discourse from conservative sectors that think that we promote libertinage lifestyle. And rules are in constant change due to the elected governments. And we also have a weakening of democratic system in all Latin America. And in Peru, it affects the defense of sexual and reproductive rights. And lastly, we have the stigmatization of youth that defend sexual and reproductive rights, so the activists. So there may be many obstacles, but those committed with the advocacy, we will overcome them.
Straight into Selma to give her pushbacks as well. You just pinpoint them, the two pushbacks that you get to experience or the difficulties you face in your advocacy space. Samaria, over to you.
So like I mentioned earlier, SRHR issues are usually considered taboo. So the culture, the social norm, the religion doesn't really allow you to openly talk about SRHR issues. So some of the things we've struggled with is one example is the anti-choice movement, specifically for SRHR issues and also specifically related to abortion. So they are really strategic in using social media, religious influencers, really high stakeholders like influential people, and also the cultural and religious norms that doesn't really allow you. So when they come through that, in Ethiopia, the culture, the social norm, and people listening to religious leaders is so much easier. So it's usually they right away listen to them and change their minds. So when you're advocating for SRH, you really struggle with that, trying to make people believe that it's just the right thing to do. It's for young people to make informed decisions. And that's why I think we need evidence-based advocacy to show them the numbers and the struggles young people are having in order to make them believe, which is really hard when it comes to that in Ethiopia. Hi everyone. My colleague laptop just blanked out, so I'll be moderating right after this. So the last points we have is everybody to share their call to actions regarding their respective organizations and what they have to say. So I'm going to start with Sarah.
Thank you very much, Maria, for the floor. So for like the final call that I would like to say is maybe directly related to my role as a pharmacist. And it's something that I want to address to all adolescents out there. I just want to highlight and repeat over and over again that pharmacists are trained to help you. And we continue to push for ways to elevate SRHR locally and globally. So you can trust us. Next time you're unsure about a decision that you have to make, just go to your community pharmacist. They will listen and respond to your needs to the best of their ability. So yeah, thank you very much. Back to you, Samari.
Thank you, Sarah. This is such a good perspective from a pharmacist. And Salma, we'll go to Salma next.
Okay, thank you. But before I explain about my call for action, I will explain about my pushback or difficulty. Actually, as an adolescent who tries to influence adults, policymakers, and government institution representatives who have higher education than us, there are some concerns which we think might be quite challenging for advocacy. Among those are, one, some government bodies tend to show normative responsive. We believe that there are already a lot of policies, regulations, and programs from government for adolescents health program, especially for reproductive health. But the evidence we obtain from the research shows the facts as mentioned by adolescents' views, which is the main beneficiaries that should be considered in improving the quality of regulations, policies, and government programs. And two, reproductive health right issue is not yet considered as a national priority, which leads to little interest from government on this particular issue. Unlike stunting, maternal and children's issue, reproductive health right issue is not yet perceived as a national priority by the government of Indonesia. And for the call for action, I believe knowing is surviving and knowing is fighting. When we know how to survive, we know how to fight for our rights. That's why knowing comprehensive information and services about SRHR matters for us. Thank you.
Thank you, Salma. I'll also go back to Sarah again so that she could tell us the pushbacks and challenges they've been facing when advocating for SRH. Sorry for not doing that earlier.
Thank you very much. No problem. So I'll be brief, just highlight or illustrate through one example, and maybe that would echo what you previously said. So it is no secret that today, like talking about SRHR is still perceived as a taboo in many societies around the world, and not everyone gets the necessary education. Therefore, like one of the things that our member organizations try to do locally is to approach high schools and middle schools in their own communities to propose educational activities that raise awareness in regard to SRHR and empower like students to take action about their own body. Nevertheless, not all of those schools like welcome these initiatives. Oftentimes, they will always have concerns like either the parents or the teachers or the institution itself. And we find ourselves like letting go of this idea, which is kind of a hindrance to the progress that we should be making on national, local levels to promote SRHR. So when we think about it, like guidelines and recommendations are there. When we attend high-level meetings, we notice that member states and different countries also show support towards it. Yet the reality on the ground is very different, and we lack action. We don't necessarily walk the talk, and we should definitely start doing something about that. So thank you very much, Maria. Back to you.
Thank you so much, Sarah. I'll go to Romania to give her last call to action.
Gracias por la palabra.
Thank you for giving me the floor. Based on my experience as an activist for sexual and reproductive rights, starting when I was 15 and now I'm 25, meanwhile, what I did to start to defend sexual and reproductive rights was looking for spaces that defend that. So I got skilled and empowered with information. And this is the recommendation I leave to you all, those who are following us through your skin, that you want to start to work in the defense of sexual and reproductive rights. Look for organizations that understand yourselves, inform yourselves, and start to act, because activism is something that we all can do. Thank you.
I'll go to Bahumika next.
Thank you. So I think in just few words, if I can say what my call for action would be, it would be engage youth and SRHR awareness together. So as you can understand from the few words, it actually needs to, sort of reaching out to as many young people and adolescents as you can, and then sensitize them and make them aware of, different domains or different issues pertaining to SRHR. Thank you.
Thank you so much, everyone. I'll finish up by my call to action. So my call to action is advocate with evidence and drive change in SRHR. So as young people, we should be self-reliant, healthy, to advocate for others, and also advocate with the correct data to create reasonable doubts among people we advocate to. So thank you so much for attending this session. This was such a nice session, and I want to thank everyone for being here. So, bye.